Canine parvovirus CPV, most widely known as parvo, is among the most dangerous viruses that may infect dogs. Fortunately, with the right vaccination, it is highly avoidable. After being identified in the 1970s, this virus quickly started to pose a major risk to the health of dogs. This is mainly due to the fact that the virus is very contagious, difficult to eradicate, can survive for a long time in the environment, and frequently results in death if treatment is not received. For this reason, the parvo vaccine is regarded as essential for dogs and puppies. Parvo in dogs is still very common, especially in pups and inadequately vaccinated adolescent dogs, even if the danger has decreased for dogs that have received the very effective parvovirus vaccination. This is all the information you need to know about parvo in dogs, including how to protect your puppy, what signs to look out for, and what to do in the event that your dog becomes ill. A contagious DNA virus, known as canine parvovirus, frequently leaves young, unvaccinated dogs very unwell. Since it mostly affects the body's fast-dividing cells, the intestines and bone marrow are most severely impacted. Parvovirus can potentially harm the heart muscle cells of extremely young puppies. While parvovirus is more frequent in pups and young dogs, older or adult dogs may still be affected, particularly if they have not received their vaccinations. When a dog contracts a parvovirus, symptoms often appear 3 to 7 days after infection. Lethargy, lack of appetite, and fever are among of the early symptoms of parvo. As the virus spreads, your dog can start having diarrhea, vomiting, and abdominal pain. Puppies with severe parvovirus illness may collapse, experience a rapid heartbeat, struggle to breathe, have low white blood cell counts, be hypothermic, or have hypoglycemia. Dogs can contract parvo by contact with contaminated excrement, however the virus can exist without visible feces. It can survive on contaminated surfaces such as the ground, kennels, hands, objects, and clothing. If their fur or paws have come into contact with infected material, dogs may also harbor parvovirus. Dog parvovirus is a highly contagious illness that spreads swiftly and effectively. The parvovirus is resistant to many disinfectants and can live for months or even years in a dog's environment. It is, nevertheless, vulnerable to several specific cleansers frequently used in veterinary facilities, as well as diluted bleach. Since parvovirus is species-specific, humans are infected with a unique strain of the virus. This implies that neither humans nor dogs may contract parvovirus from one another. It's crucial to wear personal protective equipment and exercise extreme caution if you come into contact with a parvo puppy, though. Even while you might not contract parvo, your hands or clothing could harbor the virus and transfer it to another dog. Parvo SNAP tests, also known as fecal SNAP ELISA tests or enzyme-linked immunosorbent assay tests, are the most widely used diagnostic method for parvo in dogs and pups. It takes roughly 10 minutes and calls for a fecal swab. Even though this test is precise, a negative result does not always mean that a dog with symptoms does not have parvovirus, because the dog may not be shedding the viral antigen at the time of testing. In certain situations, more testing might be required. The parvovirus is introduced to the puppy or adult dog through the feces of an infected dog. A dog may become infected by the surroundings, ground, or surface, or an object that comes into contact with an infected dog, even when there isn't any visible feces. The dog contracts the parvovirus during an incubation phase about 3 to 7 days, during which time it does not exhibit any symptoms. The virus targets the body's fastest dividing cells during this time, usually beginning its attack on the tonsils or throat lymph nodes. The virus can multiply swiftly and efficiently to infiltrate other sections of the dog system by targeting these fast-dividing cells. The parvovirus will look for other sources of quickly diving cells once it has expanded and reached the circulation. The cells lining the walls of the small intestine and bone marrow are the most severely affected. Parvovirus infection of the heart can also result in inflammation of the heart muscle in very young puppies. The parvovirus targets the immature immune cells in the bone marrow, causing a decrease in the white blood cells that provide defense. As a result, the body's defenses are weakened, making it easier for the virus to enter the digestive system. The worst harm occurs at this point. The virus damages the small intestine's lining, making it difficult for the dog's G-tract to absorb nutrients, stop fluid from leaking into the stool, and stop germs from penetrating the gut wall and entering the bloodstream. Serious health problems result from this, even while parvo in dogs is not always deadly. The majority of those who do not make it usually pass away from shock or dehydration, in addition to the harm that the septic toxins from the intestinal bacteria escaping cause. Since there is no known treatment for parvovirus in dogs, the focus of care is on bolstering the puppy's immune system. When a dog contracts the parvovirus, supportive therapy usually consists of hospitalization with intravenous fluids, antiemetics to prevent vomiting, nutrition counseling, including the use of a feeding tube if needed, and correction of any electrolyte imbalances or low blood sugar. Additionally, some veterinarians could advise canine parvo monoclonal antibody therapy. Antibiotic medication is necessary for puppies displaying signs of sepsis, a condition in which the gut becomes so leaky with disease that intestinal germs enter the bloodstream. Antibiotics may also be given to puppies who have a low white blood cell count or a high fever. Dogs' recuperation from parvovirus differs from instance to case. The length of time it takes to fully recover may depend on how severe the illness is and how much damage it has caused. Dogs who are susceptible to infection frequently show signs of illness 5 to 10 days after they start. In order for parvovirus-affected puppies' intestines to heal, proper diet is crucial. Dogs with parvo should be fed a simple, easily digested diet while they are healing. The duration of hospital stays varies based on the severity of symptoms, although they usually last 5 to 7 days. In dogs, the peak risk of death happens 24 to 72 hours following the onset of parvo symptoms. A puppy with parvovirus typically has an 85 to 95% survival probability if it is hospitalized, receives a lot of supportive care, and is properly watched. If the dog does not receive prompt veterinary intervention after exhibiting clinical indications, or if it is not hospitalized with adequate supportive care, its chances of survival are increased. Thank you for watching. Don't forget to like, share, and subscribe. See you on our next video.